Good evening, everyone. My name is Trinea Reed. I am the Workforce Development Manager here at the Amputee Coalition. This evening, I have the pleasure and honor of introducing Dr. Julia VanderMolen. Dr. VanderMolen is the Associate Professor of Public Health at Grand Valley State University. And today she's going to talk about careers in public health. I also have Paula Galladay, who's our workforce development volunteer that will also be on the call to monitor the chat. So thank you so much, Julia, for joining us this evening.
Well, thank you for having me, and I'm honored, and it's going to be a pleasure, at least for me. I could talk about the careers in public health for hours, but we only have an hour, so I'll give you the quick and easy. And then if you have any questions, please feel free to. I'm sure Trinity will share my contact information with you, and I have my contact information in this presentation as well. So let's begin. Again, welcome to Careers in Public Health. And again, my name is Julia VanderMolen. I'm a Associate Professor at Grand Valley State University in the Department of Public Health. I'm also a certified health education specialist, where I work with, and I primarily work with persons with disabilities, which I'll get into later in the presentation. But for now, we'll go through some of the logistics of this presentation. If you'd like a copy of this presentation, this code will last for about 16 days. So please feel free. I'll give you a couple seconds to scan this if you'd like, or I can also send it as a PDF to Trinea and Paula. That way you have it. So please let us know if you want a copy of that, if you don't have time to scan it, or if you don't have your phone available. I'll give a couple more seconds on that. Okay, I have no disclosures, no financial relationships exist with this particular presentation. So again, letting you know that I'm doing this because I love this topic and I love working in the field of public health. And Eleanor, I will make sure that you get a copy of this. I'm assuming we have an email list of all the attendees. I'm writing it down too, just in case. So thank you. So just a little bit about me. Again, I'm an associate professor of public health within the School of Interdisciplinary Health. It's a mouthful at Grand Valley State University, which is located. I'll just do a minute. If you're familiar with Michigan, we Michiganders, we do this. We do this. I live right here, right on the lakeshore. So at Grand Valley State University, I received my PhD in educational leadership with an emphasis in career and technical education from Western Michigan University. I also have an MED in educational technology and a master's degree in health sciences from the University of Alabama and a master's degree in biology from Clemson. I love to learn and I love schooling. And one of the things, a lot of my research is connected to assistive technologies, universal design for learning, and working with persons with disabilities in public health. And I'm actually working on another project that started just recently, and I'm going to be working with and partnering with our culinary program at our community college and teaching individuals with low vision and blindness how to cook. So that could also be a career, by the way. You can actually go into public health nutrition. So kind of keep that one in mind. So for today, we're going to explore careers in public health. Now, oftentimes when actually I have an activity, so we'll hold out there. We're going to discuss the education needed for a career in public health, and we're going to touch base a little bit about workplace accommodations and assistive technology for persons with disabilities and working in an inclusive workspace environment and what that looks like for like healthcare professionals and HR professionals. So I have a question for everybody. How do you define public health? And you may use the chat if you'd like. And I'll give everybody a minute or two to actually give me an idea of what public health is. I've got the chat open. I'm hoping people are typing because I don't see anybody popping in. Okay. Oh, yay, we got somebody. Okay. Wonderful. Government, county services. Yes, absolutely. You can work at the state level. You can work at the county level. Okay. Sociological, psychological support. Yep. That works too. Healthcare services. Yep. Public health, hospitals. Area health is related to the general public, and yep, the population in itself. Helping others that need assistance with a variety of questions regarding health and social assistance. Yep, that's part of public health as well. Okay, these are great definitions, and guess what? There is a job for every single one of these. So as it relates to public health, you can be an advocate for public health. So that's great for the general public. You can work in the community and work in certain healthcare initiatives. So you're looking at the psychosocial and mental health is a large one. We actually have a program in our area in Grand Rapids, Michigan, where I'm from. It's called the Be Nice campaign, and it goes out to the K-12 system where we actually have trainers talk about bullying, believe it or not. And it is a social determinant of health. So mental health is. And looking for assistance, we have those services in place. Pretty much every state has those in place, and those are the policymakers too that can provide that information to you, so you can work in policy and provide assistance. And there are programs like the SNAP Ed, for example, and that's for AKA used to be called the food stamp initiative. So we have some of those things in place. And we're going to go through, and as I go through, I'm going to show you some places where you can find careers and what other things are out there. And I'm going to give you another listing of potential opportunities. So this video, I was going to show this video. It's 4 minutes, and I don't want to, is it okay to show this, or do you want me to kind of share the video later?
We can share the video. That's fine.
Okay, because it's a good video and it talks about what public health is really truly all about. But I'm going to get into it as well. So, there we go. So why is public health important? And I want you to take like a moment and just kind of really think about the things that are all around you. And it's funny, it's like, if you're not familiar with the movie, My Big Fat Greek Wedding, you can give me a thumbs up, or you can, say yes in the chat. If you're familiar with that movie, and in the movie, one of the main character goes, give me any word, and I'll show you the root word is Greek. Give me any topic, and I will tie it back to public health somehow. Because everything around you, from the bike helmet that you put on, to the water that you drank today, to the toothpaste that you used, to the toothbrush that you used, to the shower that you took today, to the food that you ate today, the lighting that you have in your home, the air conditioning if you have it, everything around you can be connected back to your health somehow. And what public health does, and this is just a basic piece of it, is we track diseases and outbreak, and we can tie that one back to one that's really been quite prevalent in the last 4 or 5 years was COVID, right? We still have the flu, we still have, kids getting measles and the mumps and chicken pox and whatnot. We have other outbreaks going on, but we track how that's happening. Vaccinations, vaccinating in communities. So the primary ones that we look at as we age, maybe the shingles or the flu, or there's a new commercial out there in the pneumococcal, so that for pneumonia for the older population. Looking at safety standards in OSHA, we take a look at hard helmets, hard hats for our individuals, working gloves. That's also considered a public health issue. Maybe it's the environment, and maybe it's the air that they breathe, and then they need air assistance while they're in their field. Developing school nutrition programs, and I brought that one up when we teach teachers about food allergies. And then we also take a look at how we help kids with better nutritional standards of eating, instead of having like the pizzas or the chocolate bars or whatever. We provide healthier food options. Another thing that I work on is I work as in the state with policy. We just passed it in one county to have healthy vending machines in all the counties in the state, so that most vending machines have candy in them, or they have Pepsi, Mountain Dew, or Coca-Cola, or whatever they may be. So high sugar. So we have a program called the Sugar Smart Coalition, and we work on that, and we create policy, and we've been able to land a good amount of funding to actually support that program on its own now, advocating for laws to keep people safe. I keep seeing really good ones. It's the bikes, the 3 feet from the car to the bike and having the bike lanes. It's speed limits, going lower, going 70 or less, or they're doing the required speed limit. And if the faster you go, the more chances are you're going to end up getting in a car accident. I've seen some of them with drinking and driving as well. So, all of those, the laws that we advocating for us to keep us safe. So that's just kind of like the basics of what we could be potentially responsible for in with the field of public health. So is there any questions at this point on why we do public health? I mean, we could talk about gun violence. We could talk about climate change, which is happening. We could talk about, declaring racism as a public health crisis. One of the things that I think is a public health crisis right now in our country is what we call literacy level. And there's health literacy levels, and we have digital literacy levels, and how we can connect the dots to all the different types of literacy to health. Financial literacy, health literacy, digital literacy, health literacy. Because a lot of us, and you can do a thumbs up or a thumbs down, to use an emotion if you want, and say, yes, I look up stuff on the internet for health. I bet everybody can say that they have done it at least once. Okay, and how do you know if that's credible information? Okay, so what, you've never done it? You don't look up information on the internet, not even just a little bit for healthcare. That's James. I do look up information on healthcare. I do it on a day-to-day basis. As a matter of fact, I do it for food. So I like to look up my nutritional values, like is blueberry, raspberry, or a blackberry? Which one is the better fruit for you? They're all berries, but which one truly is the better fruit for you and its nutritional content? So something like that. But you have to, it's knowing what good information is. And we've had that problem too with regards to information that we get from healthcare. It's a misinformation, but we can get into that. That's a totally new topic. Okay. The other thing I want to kind of address here is some of the statistics that are out there with regards to working with persons with individual disabilities, but also in the public health field, which I will get into. So some labor statistics. In 2023, the employment population ratio for people with disabilities increased by 1.2%, 1.2 percentage points to 22.5 percentage points. And this is coming from the BLS, the Bureau of Labor Statistics. People with disabilities are less likely to have completed a bachelor's degree or higher than those with no disability. And that also came from the Bureau of Labor Statistics in 2023. And higher ed is actually addressing this issue by having student organizations and having offices, what we call disability resource support offices at every college and university to help the individuals be more successful in the academic realm. And our university is actually doing that as we speak. We actually just did interviews, and we're hiring somebody to do the main office and promote assistive technologies within our college, so our college and universities, so that individuals with low vision, or maybe individuals who are neurodivergent, can have those services, which is great, so that we can make sure that they're successful in the academic field. And if you'd like, I have some really good information on that. And there's like a PDF that I can potentially send you to if you're interested in the more statistics on that information. So we also have public health job opportunities, and I will share a link with you in just a moment. That's behind this PowerPoint, but we're expected to grow by 13%. By 2024. So this year, we're expected to go 13%. And the average wage or median, is 58 to about 95. salary. And you can either have a bachelor's degree or a master's degree. Our field is going more toward a master's degree, but there are programs and jobs out there for somebody with a bachelor's degree in public health. It's typically a degree called community health. And oh, thank you for those those statistics, Paula. Thank you. Graduates, again, you can have food inspector, you can be an epidemiologist. That typically requires you to have a master's degree. Infectious disease specialist typically requires you to have a master's degree. But a grant writer, you don't have to have a master's degree. You could have a bachelor's degree. Emergency preparedness coordinator. Our county emergency preparedness coordinator only has a bachelor's degree, and she's very specialized. So she gets certificates in emergency preparedness. We also have policy analysis. I have a colleague of mine who's a policy analysis, and she also sits on the Sugar Smart Coalition, and that's how we were able to pass the healthy vending machines for that county. You can be an advocacy director can also start out with a bachelor's degree and move on to a master's degree in public health. There are a ton more opportunities out there. And what I'm going to do is actually have us explore that, but I want to kind of give you a context. I'm going to stop the sharing. Oh, actually, I could probably just escape out of my presentation. Hold on a second. I'm going to show you this for a reason. This is a weekly newsletter that my university's program actually puts out to all of our students. And I'm going to scroll down. Actually, I think I can use this. Jobs and internships. Okay, so this will kind of give you a greater or a wider context of what is out there in the realms of public health. And I'm kind of like cipher through some of these for you. So here are the jobs and their titles. I don't know if I can make this bigger. Let's try it. Okay, making it a little bit bigger. So recovery incentive project coordinator, bachelor's degree. Public health and health analyst, that's usually a master's degree. Grants and contracts, that's usually a bachelor's degree. But you're seeing different titles within the field of public health. They don't necessarily have to be somebody who's clinical in nature. You can have this background. So for example, James Madison University, looking for somebody who can coordinate well-being, coordinator wellness program. So if you're organized, an individual with a bachelor's degree can coordinate wellness programs. There's the emergency preparedness coordinator. And then you have all these other jobs. And this is what goes out every week. And these are the jobs connected to public health. There are a ton of them. And this is just the beginning. I should scroll back up, just going to give you context. Here's the beginning. And we're going to continue to scroll. And continue to scroll. And continue to scroll. And continue to scroll. So you can see where this is going. There's a ton of positions out there that are going unfilled, and you can have a bachelor's degree or a master's degree in public health, and you can see what their titles are. Research coordinators, fitness experts, gene therapy, physical education policy and promotion fellowships, policy analysis fellowship, motor vehicle injury prevention fellowship. So you can see where this is going. You don't necessarily have to, it doesn't have to say healthcare in it. It could be a totally different job title and connect to public health. Okay. So this one's like a big one for our students because it's free tuition for our students if they apply for this one. But this kind of gives you a context of what's out there with regards to public health and how you can find jobs in the field. And I'm also going to show you another website too. And thank you, Paula, for putting those in there. Emergency services is definitely one that a lot of folks don't realize is a healthcare career or connects to public health. There's so many organizations that look at public health, and there's nurses go into public health, EMTs can go into public health, and you don't necessarily have to have a master's degree to be an EMT. You can have an associate's degree, and then you can get your bachelor's degree in public health. Okay, and then so you can really go however you want to go in public health and find where you're passionate about. More oftentimes than not, individuals who go into this career field are passionate for a reason, and they're in it for making a change in the community. So what I want to kind of share with you is, I'm just going to go back to this. Can you still see my screen? Did it change over to the PowerPoint? Excellent. So from the BLS, Health Education Specialist, this is also new. There's NCHEC, which also is called, it's the National Accreditation for Health Education and certification. And then there's also the epidemiologist. So if you take a look at the BLS, hopefully this will pop up, you can see what's needed. So here, a bachelor's degree, and it kind of gives you an idea. And again, the range has already changed on what the outlook is too. Even though a master's degree is 14, I think 13%, where bachelor's is shows a 7% growth or 7% growth in the field. But you can see here kind of what they do. Let's just click on this. And I'm going to make this a little bit bigger. So, and I often tell students, well, you know, you can work in a nonprofit. And your nonprofit, we have nonprofits that help women with breastfeeding. We help nonprofits that help dads be dads. And we have nonprofits that help children. They just opened up a brand new office here in town to help children with immune compromised systems. So they're considered a child with a disability. And so we have that. But these are the kind of things, these are the tasks that somebody within health education, who's an health education specialist, could potentially do. We do a lot of research, and we do a lot of designing of educational materials and training the community on some of the leading practices of staying healthy. Eating your fruits and vegetables, what does that look like? Proper breastfeeding. Do we have enough breastfeeding rooms within the community? One of the initiatives that my actual chair did in the past, and we implemented them actually pre-COVID, was we didn't have any breastfeeding rooms on our campuses. And now we have one on every campus and pretty much one in every building. And so those are the kind of initiatives that you can actually implement as someone who goes into public health or as an health education specialist, which is a branch of public health. So we also take a look at teaching people how to work with their existing conditions and helping them actually develop a workout program. And I actually have a student who did that last year. She actually created workout plans for students with physical disabilities at our university, and now they're all being implemented, which is phenomenal because we didn't have that opportunity for those individuals to begin with. But going through this again, healthcare facilities like a hospital, public health departments, where we're looking at creating policy, wellness topics, and the like, and looking at grants and grant funding is really a big part of the career for sure. Is learning how to do that. But we do a lot of research, and we do a lot of community outreach and helping the community learn how to get healthy and to stay healthy. So this is just one piece of it. Go back here. I'm going to go to NCHEC, which is another resource. They just did an update to their website like 2 days ago, literally. And this actually has a career hub. You can go here and you can do all of their, this is again, some different titles: healthy living coordinator, employee wellness coordinator. So employee wellness, I have a former student who's in Florida right now, and she works for a company and she does all of their employee wellness coordinating. It doesn't have the word healthcare in it whatsoever. It's got wellness in it instead. Training and field service coordinator. I have another student who is a food safety specialist, has her master's degree. She went and got her bachelor's degree first. And ironically enough, she went from being a nutrition educator for the organization, and they promoted her 3 weeks later to food safety because that's what they wanted her to do afterwards. So she already got promoted, which is kind of great. But this is kind of like a small snippet of what is out there with regards to the careers that you can get in the field of public health.
And
Yes.
Julia, we have a question in the chat that you may wish to address before the end of the program. Teresa wants to know, she has a degree in biology
Mhm.
and she would like to go into the public health field now that she has identified herself as somebody with a disability. Would she need to acquire another degree?
Nope. That's a great question. And no, you would not. You can actually go into and look at the prerequisites for public health programs. And for example, you can have pretty much any degree, bachelor's degree, as long as you have a 3.0 to get into the Grand Valley State University's program. And it could be in any topic. I have a master's degree in biology. My bachelor's degree was in biology. So you could definitely do that. So you could be interested in maybe being an epidemiologist, or maybe you want to look at nutrition or whatever your interest might be. What was her? It was is Therese? No. Oh, yeah, Therese. Okay. So definitely could do something in public health. And they have organizations too in public health that are geared toward veterans and persons with disabilities. I sit on two boards. One of them was for the Association for the Blind and Visually Impaired, and I help with orientation mobility. We develop programs, nutrition programs. I mentioned earlier that I'm partnering with the community college, and we're going to be teaching healthy cooking skills for the individuals with low vision and blindness. You can also, and that's connected to public health because we're trying to keep people healthy. And I also, I'm on the board for the Disability Advocates of Kent County, and we do a lot of home assessments. So you don't necessarily have to, again, you can have a bachelor's degree in biology and go into public health and go from there and find your niche. We have students who are so interested in everything. It's got, okay, you got a funnel. You got a funnel because then you know you want to change the world, but funnel. So we have one student who wants to, who's actually developing training programs to help women with postpartum and pelvic floor exercises. I had no idea that there was even a thing. That's how big, bro. That's how big public health really truly is. And so, and she's doing that. And I have another student who's working with neurodivergent persons with autism spectrum disorder and helping them with career fields and working with career services at the university to help them better understand what types of careers can be beneficial for somebody who's neurodivergent. So I hope that helped you, Teresa, or Therese. Is it Teresa or Teresa? Diana. Yeah, I'm going to answer Diana's question too. Diana, her question is, do veterans have a possibility to study? Yes, we have veterans in our program all the time. We have one that just was interested in nutrition, became a nutrition educator, and now he works at the VA here in Michigan. So that's a great, and there's so many services. We had another student who developed for our university a veterans office and a veterans wellness program at our university, and it's extremely successful. It created him a job. He created himself a job. So, but yes, there's definitely a possibility. It's just finding the right niche. I had another student who her brother is a veteran, and she wanted to make sure that there's a repository of resources. So she created a document with a lot of resources on it. And again, you got to find your right niche. If you want to work with veterans, where do you see the gap? And that's where you start looking to find those elements or those pieces. Good questions. Thank you. Nice. Did I miss anything else? Okay. Okay, that's from Paula. Okay, great. Okay, I'm going to go ahead and go on to the epidemiologist piece. Oops, back one. So in epidemiology, this is a little bit more science-based, a little bit more number-based, but this is kind of what they do on a day-to-day basis. Notice there's like a veterans piece for you here, Diana. And what kind of skill sets are they communicate findings? They do a lot of research, look at database and software. These are the kind of things that they do. We have at our university, we have two epidemiologists, and one of them's the president and editor of the Michigan Public Health Journal. And the other one is the lead for and the chair for the APHA, the American Public Health Association's genomics section at APHA, what we call it. And so she actually does epidemiology and genetics. So there's something that you might want to think about too. But this is the task or the skill sets that they do. They look at data, they process information, they work with a health promotion person to create health literate materials and information. And they do, again, they train, they do research on parasites, they collect data. We had students collecting it on ticks and mosquitoes, which would not be my thing to do, but they look at the environment, they have discussions, they do quite a bit. And then you can see here, required an epidemiologist, typically you should have a master's degree, and you can have some other degree outside of that if you'd like, but typically it's just an MPH, maybe even a doctorate in occupational therapy, a doctorate in public health would be sufficient as well, but primarily a master's degree in public health is what is required for a position in epidemiology. And you'll see, like, if you're a physician, a PA, nursing, I'm trying to think, I lost my train of thought there, but they will also go to, and medical doctors will also go to a master's of public health and get a degree, even though they've got a doctorate degree. Because that way they have a base knowledge of not only the disease process, but how to triage the disease process and how it happens. But this is your basics of what an epidemiologist does. Take a look at this. So, and again, it breaks down, and I'm going to provide this all to you so you have it, so you can kind of go and, yeah, I think I want to be an epidemiologist in public health. I think it's going to be a lot of fun, and it is a lot of fun because you get to meet new people all the time. Let me go down here. It looks like we got. Okay, you're welcome, Diane. I'm looking at Paula's comment. IT. Oh, yes. Are you thinking about like web page coding and that kind of information? Yep.
Correct. So the coder may not fully understand public health and every aspect of that. But if I cannot access a web page because I'm blind and it's not been coded correctly for my screen reader to read, it's useless to me. I'm looking at a black screen.
That is correct. And there are organizations actually working on this, and you can get a credential for that too. So you don't necessarily have to have a public health degree, or you can get a bachelor's degree in health communications and go into the public health field and work alongside somebody who's a web developer. I do know that in Kent County, the Association for the Blind and Visually Impaired and some other organizations are working collaboratively with healthcare to create accessible documents and accessible web pages. Because, like Paula alluded to or said, if it doesn't help with a screen reader, then it's useless information. There's nothing for them to read. And there's been a lot of push to make sure that that's starting to happen at all levels. So that's a very good point. So again, working collaboratively is a big point. Let me go to the next slide. We have specializations as well. Most bachelor programs are 4-year. Most master's programs are 2 if you complete it full time. Most people go part time. We have our full-time program and a hybrid program, where you can take most of your classes online. And a lot of places are doing that right now too, to get that degree. And then you can also get a specialization. It's called a Certified Health Education Specialist, and that's the specialization I have. And then we have our epidemiologists who have the credentialing in public health leaders. And that's what we call the CPH. And then they're both credentialing exams that once you finish your 2-year program in public health, you can sit for that and have that credential after your initials of MPH. So how are we doing for time?
We are at the 5:37 Eastern time. level.
Wonderful. Okay. So sections of the workplace, I kind of talked a little bit about this, but we have emergency management where you can work in disaster preparedness. And one of the things that has been changed, at least in the state of Michigan, is we're really honing in on how we work with emergency management and working with persons with disabilities. Give you a really good story, and public health is about storytelling too, by the way. When we had a bad winter, I think it was pre-COVID, so it was before that, and we started triaging emergency management, where we had some really bad cold stretches of weather in January and February, and a lot of the power lines went down, and the power lines were going to be up for weeks on end, and then individuals who were living in assisted living and residential homes, emergency management didn't even know how to deal with them. They didn't know how to work with individuals who couldn't speak or who needed special care. That was a problem. So at that point, the powers to be came together and created a program. And now we have people who can get a credential from the county on emergency management. Health organizations and agencies, we have a plethora of them, and they're probably in your city or state as well, where you can actually probably Google health organizations and agencies within your area, and you're probably going to come up with a big list of them that say, okay, maybe it's on breastfeeding, maybe it's on food assistance, maybe it's on food allergies, maybe it's on working with persons with disabilities, like the Association for the Blind and Visually Impaired. Those are the agencies that work together. Maybe it's a rehabilitation hospital. We take a look at I skipped one, public policy and administration. That's usually at the state level. And this past April, I actually had 3 representatives from our state come and talk about what their health policies and their initiatives are. And a lot of them are looking at one which I never even thought about, was the transportation of breast milk. And I'm like, really? Yep. And that's a thing. And talking about, how do we transport it so it's not being searched and then thrown out, because it's a commodity technically. So I see there's another question here. Is there a subject? Yes, there is. As a matter of fact, coordinators, and I'm hoping I pronounced the name correctly. It's Shalanda. And there is project management and public health can definitely intersect. You could be a director of a public health organization or some type of healthcare organization or agency, or research facility or community health organization. And those project management skills are desperately needed. And you can put them into work by looking at how you do work with grants, or how you work with community engaged opportunities that promote healthy eating within your community, something to that effect. Let's see. Example, making Instagram. Whew. Oh boy. I'm saying, for example, making Instagram more accessible for the visually impaired. That is teaching the organization how to create accessible documents. I've been working with the Association of the Blind and Visually Impaired for quite some time, and we have been working on helping organizations within Kent County to make accessible PDFs and websites. That is a pretty big problem. We had one, and it's a great story. I love to tell it. The Lions Club. The Lions Club is geared for persons with low vision and blindness. And they sent out a PDF for everybody to apply for their scholarship. And the PDF was a screenshot of their application on a PDF, which we all know a screen reader will never pick up. So we had to go back and teach them, you need to redo this such that it can be done on a screen reader. And that's making sure that you have somebody who uses a screen reader is testing out the documents. So one of the things that you're going to start seeing now, not only with project management, but you're going to be seeing individuals who are good with technology, accessibility, and assistive technologies, helping to create those documents and testing those out and having that job description. assistive technology manager or assistive technology coordinator or assistive technology, I can't remember the title. It's assistive technology. I don't want to say tester. It's not tester, but maybe it's designer. I can't remember off the top of my head, but those are the job descriptions you're going to see that are also connected to public health. So if you have a health communications bachelor's degree, you can go into the public health career and be a project manager and work in the community health communications and work with organizations that work with persons with low vision to test out healthcare documents. It's a good one. I hope that answered your question. So going back to the sections of work. Okay, so here's another resource to share with you. It's called Public Health Jobs. I'm going to click on this one and bring it up. And what's great about this, it can keywords, location. I'm just going to go with vision. And I'm going to go with, let's go with Michigan. And I'm going to pick, see, public health promotion. Oh, did I see health promotion? I thought I saw, oh, there he goes. Let's see if anything pops up. No matching. Let's just leave it blank and see what happens. No matching. Let's just take this out of here and see what happens. Oh, there we go. What? There's project manager, not product management, but close enough. Division manager, planning promotion specialist. You can see, again, that doesn't have the word healthcare in it, but it's still connected to public health. Okay. There's a nutritionist job, a WIC educator, where health is not even remotely in that, but it's a public health job. Health promotion specialist, that's out there for sure. More listings. And you can see here all the jobs that are connected. Communication specialist and analyst. We probably could put in assistive technology and something would probably come up. Digital communications analyst. So there are a ton of jobs out there. It's just that you got to find the right title. And that's basically really all it is. So again, this is a great resource. You know what I might do? I'm just like this. I'm going to put these in the chat. The ones that are out there, that we have them. I hope that's okay. I'm giving all these resources. And I'll send these to you too. This is our newsletter. We'll go back to this. I think I'm going to run out of time. So, and Trina wanted me to kind of touch base a little bit on how COVID had really played a role in the field and in itself. And this data came like from literally a year ago. We saw a 20% increase in applications, and in our program, we did see that. And we had an influx of individuals coming into our program like crazy. And so it took a lot. So we wanted to see, people started to see that there needs to be a change in our healthcare system. And that's where public health can actually make that change for us. Whether you're trying to make a better work environment or whether you're trying to make a better outdoor environment. I just talked with somebody who's looking at making more accessible playgrounds and more accessible trails. Okay. Those are public health, going outside and being in the fresh air, or being able to go outside and being on a trail or being in an accessible park. Child play is a huge part of public health. So we have that. So COVID has shown a new generation of students the clear and vital impact of how we do research in this profession. And it's all about bringing in the community and making sure that the community is involved in what they want to know about healthcare. Okay. It's also led students and professionals to pursue the higher degree. I have a couple students who said, I'm Dr. J, I'm going to go out there, I'm going to get my doctorate in public health. And there's a doctorate in public health too. I'd recommend starting out in the field. Get your feet wet a little bit and or get out there and get some experience and find out what you're passionate about with regards to public health, and then find out. But COVID did play a factor, and it played a factor in the negative side too. We saw our workforce getting pretty brutally beat up, especially during the height of COVID, and people leaving the field in droves. We had a friend of mine said, "Well, it's time for me to retire anyway," and she's like, she was actually getting death threats. Like, you guys don't know what you're talking about. Why do we have to do this? Why do we have to do that? And it was, triaging so people wouldn't get sick. And so, but she did retire, and she's a new field coming in. But that's what also happened in our field, is we saw an influx of people retiring and leaving the field. But we also saw an influx of individuals who wanted to make a difference, which is great. There's also this wonderful article, and I can share this one with you too. Just got published in January of this year. Job flows into and out of healthcare before and after COVID-19, and it's relatively lengthy article, so that's one reason why I didn't want to put it all the way out there. But it's a good article, and if you need to, I can send this to you, and you can read it at your leisure. But this shows the current of what's happening after the pandemic. And now I'm going into a second part of my presentation, which I don't know if I have time for. Do I have time for this? Because it's like 10:02, and you wanted 10 minutes for question and answer.
We could go into the next section, Julia, and then maybe leave about 5-ish minutes for Q&A.
Okay.
And any attendees that's on the call, if you have any questions in the meantime, just feel free to drop those in the chat. And then we'll answer those as we go along with the presentation.
Okay, wonderful. So to kind of go back a little bit, I'm very much a public health researcher, and I'm looking for different types of social determinants of health. And one of the things that I've been working on as a public health researcher is looking at how we connect with HR professionals and workplace accommodations, because one of the elements of public health is, again, the social determinants of health. And one of the large social determinants of health is employment. And what folks don't realize or haven't realized is that, oh, well, if I don't have a job, it's hard for me to have food. And then you go back to the Maslow's, well, you have to have a roof over your head and food in your belly, right? Well, a job gets you that. And often we're finding that we need to be able to have employers who know how to work with persons with disabilities. So I conducted a study, and we examined some of the nuances, if you will, of employer attitudes and knowledge and awareness of working with persons with disabilities. And we often find what we do know is that there's still that negative stigma on that hiring process. And then there's limited research on the characteristics of employers for job seekers. What do they really know? And is there a stigma behind that? And employers' attitudes are pretty essential in that hiring process. And then we don't often include individuals with disabilities in the social part of the organization. And we really should, because they really can play a large role in making things better for everyone. So during my study, I actually looked at 2 healthcare organizations in Michigan, Lakeshore, and in the one in Kalamazoo. Lakeshore's the Holland area and the Grand Haven area. And what I did is I conducted a survey based on an existing survey, and I modified that survey. We had about 175 from one organization and 339 from another organization actually complete the survey. And we found some really good information. And I won't go through a whole bunch of detail on this one, but I want to go through some of the basics with you. We wanted them to understand that there are resources out there to help them better understand if their company has a DEI IA initiative. And ironically enough, most people didn't would ask, well, what does the A mean? And we're not making that information accessible. We're not making our documents accessible. And Joe has a question. Do you have a list of companies that hire with disabilities? I was an electrician for 20 years, lost my left leg. That is a great question. And that might be localized to where you are, Joe. We have an organization, the Association for the Blind and Visually Impaired, developed through my research, developed the RISE program, it's called the Reaching Inclusive and Sustainable Employment. And we have already started that database within Grand Rapids, Michigan. So we have programs like, again, they're going to be working with our community college and teaching a group how to cook. We have programs that are teaching website design, website testing, document testing. We have that initiative going in. We have 3 really big companies in our area that hire individuals with both physical and developmental disabilities. We have an organization here in town. It's called Brody Bees, and they hire individuals with developmental and intellectual disabilities. But it would depend on what you're looking for too, with regards to what you want to do. And with a limb loss, that shouldn't be a hindrance to any job, in my opinion. So you could probably do some consulting as an electrician. Shoot, electricians are needed. And if you can provide you could probably train somebody to be an electrician. That'd be a great one. So as an idea. But check with your local area and see, and get some calls. I'm not sure where you're located at, but in Michigan, we have those resources, and we're starting to collect those resources. Another resource that we have in our area is we have the Special Olympics building, and our Special Olympics building has our Disability Advocates of Kent County, which provides workforce development for persons with disabilities in our area. So, but good question. Thank you. Going back to this. So familiarity, one of the things we did discover is that a lot of HR professionals and companies were not familiar. Well, I'm pretty sure Illinois has those resources. A lot of but going back to this, organizations and companies, they were not familiar with what they could do. They knew how to put their documents out there, but their website might not have been accessible for that person. And so how do we make those changes? And they were not, one of the things what was really scary is they weren't really, and there's one for you. I didn't think about that until just now, Joe, is your Department of Rehabilitation agencies. We have 2 rehabilitation agencies here in Kent County that help individuals. So that you might want to reach out to your whoever's in Will County and look at their Department of Rehabilitation and see if they've got any voc rehab places for you. And and then Triana put in that there is some great information for on the Amputee Coalition's website for their workforce development. So definitely look into your vocational rehab departments, your local departments, and find out if they have opportunities for you as well. We also looked at comfort level and advocating and working with leadership. And what we found out here is that leadership wasn't aware, so they weren't comfortable with actually helping out, which is a problem. And they weren't sure what reasonable accommodations were. I'm like, that's kind of scary. So we've been implementing training, and often we've had individuals, my colleague who's at the Association for the Blind and Visually Impaired has been helping with the training of companies. So, and then this is kind of what we looked at with regards to, for example, vision. And most of them were not aware. They didn't have an IT person well-versed enough to provide magnification software or JAWS on the computer, or they weren't able to provide that service because it was expensive. But it's not really that expensive because you can ask for dollars for that. And so I'm making, again, raised letters on rooms and labels and that sort of thing really is impactful for any organization to have. And there are some places like restaurants, for example, who don't even have raised labels on their restrooms or anything like that. So we're trying to make those differences here, at least in our state. Okay. Oh yeah, Belk rehabilitation. Thank you for doing that. And then again, from hearing, we only had one individual actually had any knowledge with regards to having a certified sign language interpreter or web teleconference or knowing how to put closed captions on, which is not surprising because a lot of folks don't realize that the closed captions are available now, more readily available than they used to be. Lower mobility. This is the one that gets me quite often. And I published an article actually on ramps and light switches and accessibilities and chair lifts and elevators. And I did it on college campuses, and the older college campuses, and even some of the newer buildings had a lot of the modifications, but the older buildings did not have the modifications. And so they were not accessible based on the ADA existing facilities checklist. They failed it, as a matter of fact. So not having the one thing that a lot of universities were trying to get to change is where the ramps are. Instead of, you have the beginning of the building and then you have the stairs and it goes right to the door. But with a ramp, you have to go all the way around. Well, how does that make that fair? So that's something that we've been looking at our campus anyway. Upper mobility and having speech modification systems and eye mobility and trackballs for mouse manipulation. And touch screens are a huge thing right now. So making sure that they're easy to touch is something that a lot of HR professionals were not aware that they could provide an ergonomic keyboard or a easier mouse manipulation. And it's just a matter of changing it out. They're not that expensive. Cognitive aids are always there. Character recognitions for to read documents, so voice recognition and so forth. Recording devices, I like to record so I can go back and listen. And then the importance of hiring. I'm kind of going through this kind of fast, sorry. How would you rate the importance of communicating by senior leadership? And one of the things is that a lot of individuals indicated that senior leadership was not aware of the policies and procedures of hiring persons with disabilities, which is a problem. They should be like the forefront of knowing what the policy is. And then I'm not gonna go through all the demographic stuff, but I'm gonna go through. Trying to remember where it's at. Here we go. Familiarity scores. So it's based on a scale of 5. Some of them have heard of screen readers, so the mean was like closer to 5. But what was really kind of the hearing, again, with closed captioning, they'll have closed captionings with videos and so forth, and upper and lower mobility. The lower mobility a little bit more, but the upper mobility was somewhat familiar. So there's a need to have training on this particular topic. And we've just scratched the surface. I wrote a really good article with Dr. Courtney Ward Sutton at the University of Buffalo. And she looked at all of the disabilities too. And we're getting ready to publish the second article based off of this information and how we're going to start training. Because there's a lack of training in HR programs. And I actually anecdotally reached out to our teaching our HR degree program, and only one faculty knew what I was talking about, which is kind of disturbing too. So importance of hiring. communication by senior leadership on the organization's commitment to recruit and hire people with disabilities was very important to very important, which is good. They recognize the importance of doing this, but now it's getting the individual in and training that individual and keeping that individual. So retention in the workforce is what we're looking at. Trying to go through and look at something. Policy, creating an accessible and accommodating work environment as mandated in the federal national public policies, checking your local laws. You can also receive tax credits. And that's one thing a number of organizations didn't realize, is that you can receive tax credits. Do not believe that the myths about assistive technology, not all AT is expensive or complicated. You can do the simplest of things and make it an assistive technology. A pencil is technically assistive technology. Okay. And the other thing is striving for a more inclusive workspace and having those individuals, they're going to bring in a different perspective. There's one of my favorite phrases, I'm sure you probably heard it. It's nothing about us without us. You bring in that perspective, and whether you have a person with a disability working for you or not, it's bring everybody to the table, because we're all going to have our different points of view. And I think we are at time. It's actually 4 minutes past.
Well, that was great, Julia. Thank you so much for your presentation and for sharing and letting us all know about the different careers within public health. I know for me, I learned a lot and didn't even think of certain careers as, oh, that could be connected to public health. There were a lot of good resources, definitely a wealth of knowledge for sure. I'll leave a couple seconds right now if anyone has any questions for Dr. VanderMolen. Again, this will be recorded. We're recording this webinar right now. So you could always go back and review the recording later. And with all the resources and the topics that Dr. VanderMolen discussed this evening, but I'll give it a couple seconds, see if anyone has any last questions before we end the call this evening.
And I'll send this presentation to you so you have it. And you can
That
send it to
sounds
folks.
great. And I'll make sure that it goes out to all of our attendees that were on the call this evening, for sure.
Wonderful.
Any last closing remarks, Dr. VanderMolen, before we end this evening?
Well, if you're interested in a career in public health, I would encourage you to explore it. There are plenty of jobs out there, and folks, and just pursue what you're passionate about. And if you're passionate about making a difference in the healthcare field, and you don't want to go in and be a physician or a doctor or a nurse, this is the way to go. This can make a difference, and it has.
Well, thank you so much, Dr. VanderMolen, again, for your wealth of knowledge. It was definitely a pleasure speaking with you and for learning more about careers in public health this evening. So thank you so much for your time. And thank you, attendees, for also joining our webinar this evening. And definitely keep a lookout for our upcoming webinars that we have within our workforce development program. But thank you again so much, and I hope everyone has a great evening.
Thank you so much. And please let me know if you have any questions, folks. Thank you.